The first bill on the agenda is House File 3668 from Chair Bierman. Chair Bierman, would you like to move your bill before the committee?
Yes, please, Madam Chair. I'd like to move my bill before the committee.
Okay. Chair Bierman, to your bill.
Members, today, gun violence is the leading cause of death for children and adolescents in the United States. Our youngest Americans, 1 to 19. This has been the case for 5 years in a row. We all serve on this committee because we care about the health and well-being of our communities, especially our children. Generations before us sat in these seats and faced grave threats to young lives. They confronted infectious disease, childhood cancer, smoking, car crashes, and others. They followed the research. They trusted the data. They acted. And because they did, these maladies were reduced. Now, it is our turn. If this were any other leading cause of death, we would respond with urgency. We would study it. We would fund it. We would coordinate a serious, sustained response. That is exactly what creating an Office of Gun Violence Prevention would do. It would treat gun violence as the public health crisis that it is, bringing together researchers, medical professionals, educators, law enforcement, and community leaders to reduce injuries and save lives. We cannot solve what we refuse to study. The scale of the gun violence crisis is staggering. During the Vietnam War, 58,220 American servicemen were killed over a 20-year period. In 2024 alone, more than 49,000 people died from gun violence in the United States in 1 year. Between 2012 and 2021, more than 200,000 American kids suffered gunshot wounds. In just 1 year, 2021, more than 29,000 children were treated for lethal and non-lethal gunshot injuries in emergency rooms across the United States. These numbers can overwhelm us, but we cannot allow ourselves to become numb, and the deaths are only part of the story. I listened to the mother of a student from Annunciation. Chris Kelly's son was in church that day. The terror of that day has changed him in many ways. He now struggles to trust adults. He would not trust any of us. He believes adults let it happen and that we failed him. His trauma did not end when the sirens stopped. It lives in him and in his family every single day. For every individual involved, there are parents, siblings, grandparents, cousins, classmates, and neighbors whose lives are forever altered. Gun violence does not end with the bullet. The trauma ripples outward, embedding itself in the families and communities. It spreads quietly and relentlessly. For decades, research into gun violence has been underfunded and intentionally limited. We have clear data on deaths, but far less understanding of the long-term physical, mental, and emotional consequences for survivors. That gap is not accidental, and it is something we can change. I know this issue often becomes partisan the moment it is raised, but studying a leading cause of death should not be partisan. Excuse me. I said a lot of numbers, and I know one can dismiss the numbers. They are faceless. We can all just walk by the empty desks that are out on the lawn and in the hall downstairs with hardly a glance and elude any real serious acknowledgement of what 2 small empty desks mean. In Minnesota, in this committee, we have the power to take a serious, responsible public health approach. Establishing an Office of Gun Violence Prevention is not about politics. It is about data. It is about coordination. It is about saving lives. And our children are watching us. They are counting on us to do what adults did before us, to meet a crisis with courage and evidence, not silence. Let us choose action over paralysis. Let us be the leaders who said enough, because every child deserves to grow up. Every family deserves peace. And every life we save will be a quiet testament that we chose them. Thank you, Madam Chair. I'd like to move to testifiers, please.
Thank you, Chair Bierman. First up is Maggie Emery, followed by Lisa Matson. Dr. Matson, if you'd come to the testifier table, please. Welcome. Please state your name for the record and proceed.
Thank you, Madam Chair and members. My name is Dr. Lisa Matson, and I have the honor to serve as president of the Minnesota Medical Association. With over 10,000 members across the state, we are the largest professional association of Minnesota physicians. Thank you for the opportunity to testify today regarding the Office of Gun Violence Prevention. According to the Minnesota Department of Health, more than 500 Minnesotans die by firearms each year, with this number increasing annually. You've already heard about the number of children who die, but this surpasses cancer and accidental deaths combined. Guns are also the #1 cause of death by suicide, especially in our adolescent population. Behind each of these deaths is a family, a community, and often a physician who's cared for that patient. We've also witnessed firsthand the devastating physical injuries caused by firearms, as well as the lasting emotional and psychological trauma experienced by survivors and families. In recent years, the Minnesota legislature has taken important steps to reduce firearm-related harm, including expanded background checks and extreme risk protection orders. These policies matter and will save lives. But lasting progress requires more than passing laws. It requires sustained public health leadership and infrastructure that supports strong data collection, careful analysis, and coordination so preventive efforts reach the communities most affected by this public health crisis. House File 3668 would go far in that effort through a dedicated Office of Gun Violence Prevention. This office would serve as a critical partner to the medical community, strengthening the connection between clinical experience and public policy, while providing a stable and accountable structure to guide this work over time. Minnesota has successfully reduced deaths from motor vehicle crashes, tobacco use, and opioid overdoses by applying a similar framework grounded in evidence, data, prevention, and collaboration. Healthcare professionals have played an important role in these efforts, and we have seen positive results. The same approach can and should be applied to firearm death and injury prevention. This bill is about protecting the health and safety of our patients and preventing avoidable loss of life. All of you have an opportunity to one day tell your family, your friends, and your constituents that you did something to save a life. On behalf of the Minnesota Medical Association, I respectfully urge your support of House File 3668. I appreciate your time and I'm happy to answer any questions.
Thank you, Dr. Mattson. Next up, we have Maggie Emery. Please state your name for the record and proceed.
Good afternoon, Chair and members of the committee. Thanks for the opportunity to share with you today. My name is Maggie Emery, and I'm testifying today on behalf of Protect Minnesota, which is the only state-based gun violence prevention organization in Minnesota. I'm speaking today in strong support of HF 3668, the bill to establish a state office of gun violence prevention. This is not about politics. It's about stopping a pattern of harm that has devastated families and communities across Minnesota. Like many states around the country, gun violence in our state sharply increased during the COVID pandemic and the following years. However, unlike most of the rest of the country, where shootings and homicides have started to dramatically decline in recent years, Minnesota's levels of gun injury and death remain elevated. Our gun death rate increased by 35% from 2014 to 2023, with more than 20% of that rise happening in the last 6 years alone, resulting in hundreds of Minnesotans killed by firearms each year. In 2024, deaths from gun violence around the rest of the country fell by 5%, but here in Minnesota, they rose by 6%. We have seen this trend across different types of gun violence, including suicides and homicides. We don't have much research to help us understand why Minnesota is an outlier here. In Minnesota, we have a real weakness in how we collect, analyze, and respond to violence as a public health issue. Unlike jurisdictions across the country that have used investment, data-driven intervention, and coordinated responses to reduce gun violence, Minnesota lacks a centralized mechanism to marshal information, align resources, and evaluate what works. The Office of Gun Violence Prevention would do exactly that. It would bring data, research, and strategy together under one roof so policymakers, public health professionals, law enforcement, and community organizations can understand the problem and implement proven solutions with accountability. We already know that from other public health challenges, from motor vehicle safety to infectious diseases, benefit enormously from this kind of coordinated approach. Minnesotans deserve a public health approach to gun violence prevention. It's time for leadership grounded in evidence and not guesswork. Thank you.
Thank you for your testimony, Ms. Emery. Next up, we have Casey Sharp, followed by Dr. Jewett. Thank you for being here today. Please state your name for the record and proceed.
Good afternoon, committee members. My name is Casey Sharp, and I'm the parent of 2 children who attend Annunciation Catholic School. I'm here today to ask for your support of HF 3668. 6 months ago, my community experienced a horrific act of violence. My son was forced to lie under a church pew with his hands over his head as 116 bullets were fired in just 2 minutes. 5 rows behind him, his best friend Fletcher was shot and killed. That moment is now a part of my son's story and our family's story. He was inches from death and now has to grow up without his best friend. We miss Fletcher every day. And in his 3rd grade classroom, 10 little boys are not just learning math, they're learning how to cope with grief, fear, and trauma. After the shooting on August 27th, my son asked me what I was going to do to keep him safe. Honoring Fletcher and Harper's lives and protecting my children's future are the reason I am here today. I want to acknowledge that everyone on this committee cares about protecting children. We may not all agree on the best path forward, but that is exactly why we need an Office of Gun Violence Prevention. This office would allow us to approach this crisis with the seriousness it deserves through coordination, prevention, and data-driven solutions. As others have said, we've seen this approach work in other public health challenges like smoking and traffic safety. Real progress is possible when we invest in prevention. I want my 8-year-old son and 6-year-old daughter to grow up knowing their safety matters, that their leaders take this seriously and action is possible. We cannot accept a reality where children are exposed to this level of violence. This bill is a step forward. It creates space for thoughtful, comprehensive solutions, not just one perspective. In honoring Fletcher and Harper and so many others, I urge you to take meaningful action. Please vote yes on HF 3668. Thank you.
Ms. Sharp, thank you so much for your testimony. Doctor, you may state your name for the record and proceed.
Good afternoon, Mr. Chair, Madam Chair and members. Thank you for the opportunity to testify today. I'm Roli Dwivedi, a family physician practicing in Minnesota for more than 17 years. I'm also immediate past president of the Minnesota Academy of Family Physicians, representing more than 3,100 family physicians and medical student members across the state. I'm here in strong support of HF 3883, authored by Representative Bierman, which would establish an Office of Gun Violence Prevention in our state. As a clinician, it is devastating to witness the toll of gun violence, whether it is a parent losing a child, or a child losing a parent, or anyone losing a loved one. These untimely deaths leave a void that word can't fill. No one should have to endure the trauma of a life cut short by violence. Every week in my practice, I see the ripple effect of gun violence. I and my colleague throughout Minnesota care for children with anxiety after lockdown drills in their schools. We treat patients living with chronic pain from gunshot wounds. We counsel parents who are terrified about the safety of their teenagers. And tragically, I have lost a patient and cared for families after suicide attempts involving firearms. I cannot shake the memory of a mother's face in North Minneapolis a few years back. It was the middle of the night, her children were fast asleep, and a stray bullet had just pierced the wall of their home. The look of pure terror in her eyes is something that stays with you, a reminder of how fragile peace can be. These are not just individual impacts. This impacts families and communities. Gun violence is not an abstract policy issue to us in medicine. It is a daily public health reality. HF 3883 takes a public health approach to a very complex problem. Throughout my medical education, I was taught prevention is better than cure. When I think about gun violence and related outcomes, this bill would coordinate and promote effective efforts to reduce gun violence and related traumas. Right now, prevention efforts are fragmented across communities, nonprofits, law enforcement, healthcare systems, and state agencies. An Office of Gun Violence Prevention would create alignment, ensuring that successful strategies are shared and scaled. In medicine, we do not guess. We use data to save lives. Public policy must do the same. This office will lead rigorous Minnesota-specific research to replace guesswork with evidence.
Excuse me,
By pinpointing
Doctor?
exact risk factors.
Could you wrap up your testimony,
Yep.
please?
Public health campaigns save lives. We have seen it with tobacco, seatbelt, and vaccine, and we must apply the same proven strategies. Survival is only the first step. For a victim of gun violence, the trauma doesn't end when the hospital door closes. Recovery means months of grueling rehab, the weight of the lost wages, and the invisible scars of PTSD. Collaboration is our best defense. Finally, but most importantly, this office will serve as a resource to the legislatures on gun violence prevention legislation. As members of the Minnesota House, you're asked to evaluate complex proposals with significant implication. Having a dedicated office to provide data analysis and evidence-based recommendation will strengthen the policymaking. As a family physician, I'm committed to protect and promote the health of my patient. Supporting HF 3883 is consistent with that commitment. I urge you to pass this bill and take an important step towards a safer, healthier Minnesota. And thank you for your time and considerations.
Thank you so much for your testimony. Dr. Jewett, please state your name for the record and proceed, and I'm sorry if I mispronounced your name.
Chair and members of the committee, thank you for having me testify today. My name is Trish Jewett, and I'm an assistant professor at the University of Minnesota School of Public Health. While I'm an expert in my field, I'm not speaking on behalf of my university. I do research on firearm injury prevention in a range of settings across Minnesota. In Minneapolis, I work with community violence interrupters who prevent violence every single day. In a rural Minnesota town, we will bring together people with different political views and firearm owners and non-owners to identify firearm safety measures that work for everyone. In collaboration with Protect Minnesota, we created a pilot Minnesota map of voluntary out-of-home firearm storage options to reduce suicides. So far, these are pilots, but this work is needed in all of Minnesota. Minnesotans everywhere want to be part of the solution. But although U.S. firearm homicide and suicide rates are a global outlier, this research is underfunded. And in 2025, the funding situation went from difficult to absurdly difficult.
A centralized Office of Gun Violence Prevention would not only provide some urgently needed funding, but it could also coordinate between projects and make sure that all Minnesotans benefit. Minnesota has incredibly creative researchers. Some of them promote safe storage. Some study what survivors need. These survivors include hundreds of children who lived through the horrors of the Annunciation shooting and hundreds of Black, brown, and white children who lost a loved one to violence or suicide. These children do not just go back to their old lives. They are our future, and we owe it to them that we help them. But we can only help them if we find out what they need. Again and again, Minnesotans have shown that we are at our best when we care about each other. An Office for Gun Violence Prevention would help Minnesotans to do just that, protect each other. Thank you.
Thank you for your testimony, Dr. Jewett. Next up, we have Dr. Beth Elfstrand, followed by Ms. Anna Leamy. If you'd please come forward. Welcome. Please state your name for the record and proceed.
Thank you, Chair and members of the committee. My name is Beth Elfstrand. I'm a member of American College of OBGYN. I'm also a member of the MMA. I'm a recently retired OBGYN. I practiced here in Minnesota for 31 years, and I'm in strong support of HF 3668. As an OBGYN, I've always been focused on women's health and especially maternal health. I was one of the founding members of the Minnesota Maternal Review Committee, and I served on that committee for over 10 years. We all hear about the maternal mortality health crisis. We think of things like pregnancy-related things, hemorrhage, hypertension, infection, embolism as the main causes. It became very clear to me when I was doing case reviews, one after the other, that we were seeing more and more injury-related deaths. And what was very alarming to me and other members on the committee was that women who died by suicide were using such a lethal and violent means as a firearm. When I was a medical student at the University of Minnesota, we were taught men use guns. Women maybe would try a suicide attempt with drugs. That is not the case. A study that came out this year by the Society of Maternal Fetal Medicine found homicide and suicide to be the #1 cause of maternal death in our country. That means that for too many women, the greatest threat to their survival during and after pregnancy is not a medical complication, it's a bullet. This bill addresses this crisis using a public health framework that's urgently needed. First, since pregnant and postpartum patients interact with multiple systems, such as healthcare providers, social services, mental health professionals, and sometimes the criminal justice system, having a centralized Office of Gun Violence Prevention would help align domestic violence and suicide prevention programs alongside maternal health initiatives and community safety efforts so that they're working together, not separately. It could serve as the hub to connect efforts from all the various groups. In Minnesota, we have made great progress in reviewing maternal deaths and identifying the preventable causes, but we need to take it to the next level and do the state-specific research on how firearm access, intimate partner violence, and pregnancy all intersect. Without the robust data, we cannot design the interventions that protect pregnant and postpartum patients. So timely, transparent data can help us identify the trends and evaluate whether prevention strategies are working.
Excuse me, doctor, if you could wrap up your testimony, please.
Public health campaigns, like those within this legislation, are essential. We can counsel patients about seatbelts, safe sleep for infants, smoking cessation. Education changes outcomes. We should normalize the conversations about firearms in the home, safe storage, suicide prevention, And as an OBGYN, we need to look forward to the continuum of care, not just getting women safely through the childbirth process, but ensure that they survive and thrive afterwards. So we must recognize that death by firearm, homicide, or suicide are among the leading causes of death during pregnancy. This coordinated, data-driven effort would do just that. I urge everyone to support this bill. Thank you for your time.
Thank you so much for your testimony. Next up is Anna Leamy. And Dr. Rachel Weigert. Oh, there's Anna. Thank you. Welcome. Please state your name for the record and proceed.
Chair and members, my name is Anna Leamy, Director of Government Relations and Advocacy for the Minnesota Gun Owners Caucus. I'm here today in opposition to House File 3668. While presented as a public health initiative, House File 3668 would establish a permanent taxpayer-funded office with broad authority to shape firearm policy, influence gun control legislation, coordinate with outside organizations, and promote regulatory strategies under the banner of research and data collection. Minnesota does not need another layer of government bureaucracy focused on reframing and restricting a constitutional right. The proposal mirrors a recent federal experiment. The former White House Office of Gun Violence Prevention was created to coordinate firearm policy and regulatory initiatives, but it ultimately functioned as a political policy engine. Minnesota should not replicate that model at the state level. Instead of focusing on violent offenders, repeat criminals, and systemic prosecution failures, this bill institutionalizes a public health framing that treats lawful firearm ownership as a societal pathology. The Second Amendment protects a fundamental civil right. It should not be recast as a public health disorder. Minnesota taxpayers are already funding a politicized firearms litigation clinic within the University of Minnesota Law School, commonly referred to as the Gun Violence Prevention Clinic. In practice, that clinic has participated in litigation defending Minnesota's gun control laws, supported legal strategies targeting firearm manufacturers and retailers, and advanced policy positions aligned with national gun control advocacy organizations. Additionally, Minnesota already funds and operates substantial public safety infrastructure. If violence is the concern, the solution lies in enforcement, prosecution, and accountability. Creating another administrative office only creates additional bureaucracy. If this body is serious about reducing violence, the path forward is clear. Enforce existing laws against violent felons, address repeat offender release, support law enforcement, ensure meaningful prosecution, and expand direct services for victims, including greater access to mental health services. The Constitution does not prevent Minnesota from punishing violent criminals. It does, however, prevent the state from targeting peaceful citizens for exercising a fundamental right. It is for these reasons that I urge you to vote no on House File 3668. Thank you.
Ms. Leamy, thank you so much for your testimony. And next up, Dr. Rachel Weigert. Welcome. Please state your name for the record and proceed.
Rachel Weigert. Co-Chair Bierman, Co-Chair Backer, and committee members. My name is Dr. Rachel Weigert. I'm a mother, a pediatric emergency medicine physician, and a gun violence prevention researcher, and I'm here to express my full support for House File 3668, which would establish a state office of gun violence prevention. As a researcher, I'm well versed in the statistics of gun violence in America, including the fact that guns have been the leading cause of death in children since 2020, for 6 years. The extent of this issue rises to the level of a true public health crisis, and like any similar crisis, requires full, multifaceted, evidence-based approach. It is our imperative as leaders in this state to combine our collective resources to tackle this crisis head-on. We have the experts needed to do so, but without a coordinated office, these efforts remain fractured and underfunded. As an emergency room physician, I have seen the devastating impact of this crisis firsthand. I was working in the emergency department at Children's Minnesota the day of the Annunciation shooting. That shift began like many others, waking up early for my 7 a.m. start. My husband was driving our girls to their well child checks that morning. texting me with questions and later noting that it was odd that he was passing so many ambulances heading in the same direction. He knew something was wrong, and moments later, we got the call from Emergency Medical Services that we would be receiving a 10-year-old with a gunshot wound to the head. We were almost immediately updated that this was an active shooter situation at a school. As a Level 1 pediatric trauma center, our staff train regularly to be able to respond to these kinds of tragic events. The Annunciation shooting was the largest singular trauma incident we have responded to in recent history. It should go without saying, but any bullet can do an incredible amount of damage, especially to a child's small body. A bullet from an automatic rifle is designed to splinter into dozens of twisted metal shards, which can instantly kill a child. When this type of bullet strikes tissue, it begins to topple end over end and create a significant internal defect, almost the size of a torso of a young child. The conversations I had with my patients that day still haunt me. The juxtaposition of one child telling me that he was shot in the back while laying on top of his friend, likely saving his friend's life, against his innocent excitement at having received a new Matchbox truck from our Child Life team. Another young girl instinctively laid on top of her first grade little buddy, shielding them from the spray of bullets. As I removed bullet fragments from her arm and leg, she asked how we could leave the fragment in her skull, knowing that it would be there every time she brushed her hair, every day. Medically, I can answer these questions, but as an adult, I truly feel that we have failed our children for 6 years. My children, your children, and any child that calls Minnesota home deserves to know that they can stay safe from gun violence, whether at home, school, church, or anywhere in our community. Establishing an Office of Gun Violence Prevention would provide a centralized method for research and collaboration on this issue.
Excuse me, Doctor, if you could wrap up your testimony, please.
Positioning Minnesota as a leader in preventing gun violence in our communities. I urge your support. Thank you.
Thank you so much for your testimony. That is the end of the people on the list. Are there any other members of the public who wish to testify? Seeing none. Vice Chair Nadeau, I see you have an A2 amendment. Would you like to offer and explain your amendment?
I would. Thank you, Madam Chair, and thank you, Representative Bierman, for the work that you're doing on this bill. And I appreciate the number of conversations that you and I have had on this bill. And Madam Speaker, I do move the A2, and I would like to speak to it.
Please proceed.
All right. So, members, what the A2 does is it simply changes the hosting of this Office of Gun Violence Prevention from the Department of Health to the Department of Public Safety. Now, there's a couple of dozen states that have Office of Gun Violence Prevention. Some have been created by executive order under the governor's office. Some are run by the attorney general's office. Some are run under the Department of Health, and some are under the Department of Public Safety. And I think that, you know, I look at this and I think this is an important component moving forward. And I think we need to continue discussing this issue, the impact of this. And as you look at gun violence prevention, successful gun violence prevention initiatives across the country, there's a number. There's one in Baltimore that's primarily led by violence interrupters, more of a social service component. But the one that's been the most effective is actually in Boston, and it's Operation Ceasefire. Operation Ceasefire has reduced youth shootings by 63%, overall gun violence, average monthly shootings by 73%, which we all know if we reduce gun violence, we're going to reduce the trauma associated with gun violence. One of the reasons that I think that probably, I've got three reasons that I think that it should be run by the Department of Public Safety rather than the Department of Health, and that is we already have integrated data and information sharing at that level, BCA, FBI, local law enforcement, Department of Public Safety, corrections. I think there's also an enhanced legitimacy and accountability there, as these are leaders. You know, you look at how community policing has changed over the past 10 years. I mean, it used to be more robust, reaction-based. And today, we've got specialized units that deal with mental health. They deal with maternal issues. They deal with group home issues. They deal with health issues, health and safety issues. And I think that they have an incredibly proven track record of adapting in the response, because ultimately, that's who shows up first. I think that also the public safety ecosystem is a little bit better suited, and bringing in, there was a testifier from the University of Minnesota, the Gun Violence Prevention Clinic. Taking that work and incorporating that into our response, I think would be a healthy move. And the most important thing for me is that we already have measures of effectiveness, and these are data points that we want to be able to look at, set strong, hard goals, work toward, and hopefully achieve. I think that's where I'm coming from. And Madam Chair, thank you for indulging me. After speaking with Representative Bierman, we're going to continue to discuss this, and I am going to, at this point, withdraw this amendment.
Thank you, Vice Chair Nadeau. Appreciate you speaking to your amendment. And now we'll go to discussion for the bill. And first up is Chair Backer.
Thank you. And I will ditto what Vice Chair said. I know Chair Bierman's been working hard on this, and as an EMT, I have some, of course, concerns with life and death and so forth. Though I do have some concerns. Because if we look at Minnesota has been spending tremendous amount of dollars in preventing violence. If we look at it, Minnesota Department of Public Safety, $30 million. We have the CCIP grant, $30 million. CCIP, $31 million. We also have public safety budget and firearms programs. We also, through the Crime Victim Service Grant, spend $60 million annually. And then we know also that the Minneapolis and Hennepin County puts money into that program. And one of my concerns about this bill is that, when we're looking at an office, is there seems to be, and correct me if I'm wrong, it seems to me that this office would not have any serious powers to get what you're looking to your outcome. So I'm going to ask, my question I have for you, Chair Bierman, would you be opposed to investing these dollars for enhancing school safety with officers and also security measures at schools? That seems to me a better avenue. Would you be opposed of doing that?
Chair Bierman.
Madam Chair, thank you for the question, and you point out, a lot of issues around gun violence, crime prevention, public safety, all of those things kind of lumped together. There's a lot of money, yes, in those areas. And the final point was school safety. And, we do need to be moving effectively in all of those spaces. And I think this is one of the issues as I looked at this subject, the model of the continuum of information for the state of Minnesota as to gun violence prevention. It seems to me it needs something in the center that is coordinating, and data was a big part of this, getting timely data for Minnesota specific by area, and also evaluating the effectiveness of not only current programs of all the things you mentioned, but with what we know when we map this out from a state perspective and know all the players involved, and there are many, as you mentioned, some related, some a little bit indirectly. There's a lot of concerns that we have to continue to address, and this model of continuum, I think, needs that clearinghouse, which the Minnesota Department of Health would invest in epidemiologists to investigate the causes, the patterns, the spread of it, and the affected populations in a more robust, timely way. So to your question, would I rather just put this money towards school safety? I think it's not an either or, I think it's a yes and. And we need to be addressing school safety clearly in an ongoing basis, but it's also the safety of the entire society. And so I think that this would help. And just as a further thought, I would compare this to what I see with the opioid epidemic nationally and in the state of Minnesota. And so I serve on the ORAC, the Office of Opioid Epidemic Response Advisory Council, with Representative Baker. And I've seen how that has moved over the years from a really kind of coordinating all the efforts in all the state and looking too at the dollars that are invested across the state to address the opioid epidemic in a holistic way. And I see that not being present in this function of looking at gun violence prevention in the state. And I think we should emulate more of what I've seen over there to create that whole package. And opioids are the third highest cause of death for this age group as well, for kids and adolescents. So it's another problem, and there's the whole range of issues you suggested that are intermingled and co-mingling on this. So I think having the Office of Gun Violence Prevention does not keep us from also looking at schools. We're looking at that in education policy, and we all have to look at that in our communities. And there have been improvements in school safety over the years, but we need to continue that. But it's not just that. So I wouldn't say we put the money there instead of this. I think we have to think about both.
Chair Becker.
Yeah, thank you, and I appreciate that. And again, I know this is something that's important to you. And this weekend I was up at the home show in Fargo and had a constituent out of the blue comes up to me. I never met the constituent, and said to me, Representative Backer, said Jeff actually, he knew me by my first name. He goes, I think what we really need to do is protect our kids in schools. And that starts with security officers, that starts with security measures. And so I appreciate your interest in looking down that. I think that's something our students need, that type of protection. And we know that if we help with that, we know that we can get measurable results too. So to me, we have limited resources. The state of Minnesota is investing, as I said, and anybody can research that online, money already in prevention of gun violence. I think what we need to do is to put resources in protecting our schools and our students in that type of situation. So that's all I have, and I appreciate this dialogue, and I know we'll be working on this.
Representative Bierman, Chair Bierman.
Just thank you, Chair Backer, for your advice. And I do seek advice from each and every one of you on this, not only at this table, but in this audience.
Representative Van Binsbergen.
Thank you, Madam Chair. I just have some questions about, this is a blank appropriation in fiscal 26 and 27. Can you put some context around what that looks like, what that might mean in actual hard dollars? And then can you tell us a little bit more about this office? I mean, how many people are we going to have in it, and what's the future? Is this going to be a continual blank check to the taxpayers of Minnesota, or can you give us a little more detail on that?
Yeah, and thank you, Madam Chair. Thank you, Representative Van Binsbergen. Great question, and I did have an amendment I was looking to put forward that would have put some numbers in there and also change a few other words. So that will be coming when we bring this bill back up. So I'm looking at maybe 3 staff, a director, an epidemiologist, and an associate director, 3 people probably. So not millions of dollars, no. I'm talking more like 3 FTEs perhaps, as far as dollars go. And what it looks like and what they're working on is what we've just been talking about, mostly getting data, coordinating the activities of all, and interacting with all of the elements that are already out there in the state. As I mentioned on the opioid side of this, we came in and a lot of money was going out to counties and the state and to cities, but there was a lack of that coordination. And so with this department, with this agency, what we would want to do is work on that coordination of identifying much more timely data and coordinating the efforts of all of these organizations to get to a point where we can have more effective evaluation and understand what is working in real time and where we need to put more emphasis to address gun violence in our communities and throughout the state.
Representative Van Binsbergen?
Sure. Thank you, Madam Chair. Are we having a duplication of some of the things that your bill is discussing? I mean, do we do some of these programs already through the Office of Justice programs? Is there some duplication going on that you see? Sometimes in government, it sure feels like that often happens, and so curious of your thoughts of that.
Madam
Chair.
Chair, so we haven't started the program yet, and part of this involves the department, as I mentioned, looking at the holistic continuum of what's going on out there, finding those duplications and eliminating them or investing in them more if we need more of that thing. So I'm not the one who's going to be writing the specifics of which exact things we would need, but I think I might get a few more words from the department themselves. I believe Ms. Diamond might be present. And she could be maybe give us a little more detail.
Welcome. Please state your name for the record and proceed.
Hi, I'm Dr. Catherine Diamond, the Director of the Injury Prevention and Mental Health Division at the Minnesota Department of Health. And so I believe the question...
So, Madam Chair, I believe the question is there duplication going on? How would the department handle that? How could we eliminate duplication? And what would be sort of the beginning structural things that you would put in place with such an office to specifically look at gun violence in the state of Minnesota?
So as someone who works at the Department of Health, I can't speak to my colleagues at DPS, but from the conversations, the preliminary conversations that we have had around this topic, there is not duplication. DPS, it's my understanding, does great work with crime victim services, violence interrupters, so once violence has happened, to make sure that it doesn't happen again, which is one of the leading causes of gun violence is retaliation. However, using a public health lens, we use data and working with people in different areas of the field to look at the protective factors and the risk factors for violence even starting, and really looking to get to those root causes so that the violence doesn't even happen, so there isn't retaliation. It doesn't happen in the first place. So that's where the public health lens really comes in, is basing our actions on data around those topics. As was mentioned, tobacco, seat belts, motor vehicle crash, substance use disorder, those are all topics that we've worked in and have created these collaborative work groups, task forces, whatever is necessary to bring people together at the same table to talk about what is already happening to avoid that duplication and build where there's opportunity to build on successful initiatives and fill in gaps where work is not happening, so we do have experience in that. So that's where I would see our first steps being, is really bringing people to the table and building on these conversations that are already happening now to identify those opportunities and those gaps and see where we can use existing resources and then figure out what we need to do when those resources don't exist yet.
Thank you, Dr. Diamond. I'm going to do a quick time check here, and I'm going to quote my second favorite chair of the Health Committee and say we're going to try and land this plane at 2 o'clock. Did you have one more follow-up?
I just would like to make one last comment. You know, I'm concerned about the blank appropriation. It's just a lot of money that, I think if we're going to be bringing bills out, we should have the details and a fiscal note to them prior to moving them. So, thank you.
Representative Lee.
Thank you, Chair. Committee, this is not, let me be clear, a gun ownership issue. It is a gun violence issue. And even in those terms, you've heard it today, the use of the word firearms versus guns, because we want to move from guns to people, right? That's how the saying, that's what the saying is, right? Guns don't kill people. People kill people. So let's focus on the people. The city of Brooklyn Park, where I'm from, we helped to pilot the first mental health alternative response team in partnership with our local police department. And it was super successful. You can look at all the data. Brought all the incidents down and helped so many residents with resources. Law enforcement needed that extra help because they hadn't been able to deal with it up to this point. And I applaud everyone involved in helping to make that happen. So MDH already sees firearms violence as a public health issue. And they're trying to address it, and they can, in this bill, partner with DPS and all of the great interagency work that's already being done. So I think that would be a great partnership, just like how the Brooklyn Park Police Department teamed up with mental health and other social workers to create an alternative response team. Issues like suicide, alcohol and substance abuse, domestic violence, etc. These are not law enforcement issues. These are public health issues. So I ask you to please support this bill to put this program in the Department of Health. Thank you.
Thank you. And just for the record, a fiscal note has been requested. Next up, Representative Gilman.
Thank you, Madam Chair. And thank you, Representative Lee, for the segue that I wanted to talk about, and it's people, and it's the mental health piece of this. And I also just personally want to thank all those that are here in the room that sent us emails, also shared your testimony for and against this bill. We appreciate the feedback, and it's always really helpful in this work. So I'm just going to shift to mental health. We talk about people committing these crimes, and they are, the instance that we just heard today, a lot referenced this tragedy here in Minnesota, was a mentally ill person. And so I just want to ask the chair, would your office, would this new office create, would the focus be on the gun violence, and would it reduce suicide? Would it reduce, casualties in the sense of if 50% of our folks that are dying in our state and around the nation are by suicide, would it target the mental health aspect of it?
Chair Bierman.
Madam Chair, this is certainly it's a bill about gun violence, and suicide is, I've seen statistics that it's up to 70% suicides. So any violence, that is happening with a gun, and there's a lot of commingling, just as I talk about SUD issues, it's not just people who are using opioids or fentanyl. There's a lot of commingling going on. It's the same, with this situation. 20% or more of us have mental health issues at some point. And so, mental health, while we try and sometimes talk about it individually, it's always commingling into these situations. And I guess I will turn again to Ms. Diamond for any comment about how mental health would factor into this.
Dr. Diamond.
Chair and members of the committee, thank you. I think it was a great response. Mental health is one piece of this, and truly, there's a difference between mental illness and mental health. And I think that at MDH, we tend to focus on mental health, mental well-being, making sure that communities have the supports and the resources they need for mental wellness in the community, which is certainly tied to decreased incidents of violence. And so I can't predict what we would find when we look into our landscape analysis of what programs are needed or what we should kind of beef up. But I would place a heavy bet that mental well-being and mental health would be a strategy that communities would welcome and would improve rates of violence, specifically gun violence.
Thank you.
Representative Gilman.
Yeah, thank you so much, Chair. I'll just do one quick follow-up if you don't mind. So MDH is focused on the mental wellness piece of it. And as we see nationally and even in our state, would you take into consideration if people are on medications that may cause, their side effects say, this may cause this, And so when you talk about mental, health and illness, sometimes medications people are taking can cause them to, we're finding to have agitation. And so I'm just curious if you're going to factor in the medications that people are on as well that commit these heinous crimes.
Chair Bierman or Dr. Diamond?
Thank you for the question. If you'd like to answer it. you can.
Yeah. Madam Chair, Representative Gilman, I think moving to the condition of one patient involves kind of a, it's an important consideration, definitely. When we're looking at the spectrum of mental health care, mental health, mental illness, pharmaceutical drugs that people are on, you're kind of pulling together like one specific thing. And I think, are you asking, would we be able to zero in and identify that as the cause of something? I mean, we're kind of in a little bit of a vague area here as far as how that would be. We have to focus in our medical health system about patient-centered care. So when you're thinking about an individual and what medications they're on, I think and I hope that, and I know that doctors are trying to do the best they can for that patient. The worry that maybe that person is going to harm himself or herself, or that person is going to turn into a school shooter, all are things that we're trying to figure out. But there's many times when you look, deeper at school shooters that you would not know from a mental health perspective that they had a condition because they weren't evaluated or that it wasn't prevalent at the point of their attack. So we're kind of on a gray area as far as how I can even answer that question. And I know I'm probably for you not satisfying you, but it is a tough thing to answer. But it is certainly something that when you're looking at gun violence, we're going to get into the entity and the business of it and see what's on the map and try to take those types of things into consideration as best as possible.
All right.
Thank you. Thank you so much.
We have two more people on the list. If you could keep your remarks concise, I'd appreciate it. Next up is Representative Carroll.
Thank you, Vice Chair. I'll be very quick. I was going to go on about the Second Amendment. I don't believe that prohibits legitimate, reasonable gun control. But that said, I want to thank the Annunciation parents who came. I see one that I saw last week at Wayzata Community Church at that forum, which was very, very moving. And thank you for your leadership. Thank you for what you're doing. And also the chairs or the desks outside the hearing room, one floor down. Harper and Fletcher's deaths, I tell you, it brought me to tears. I mean, it's so moving, and to think that that's their stuff and they're not here anymore. We have to be able to do something. So with that said, thank you, Chair Bierman, for bringing this bill. I'm honored to be a co-sponsor. Thank you.
Thank you, Representative. Representative Purcell.
Thank you, Madam Chair. Representative Bierman, thank you for bringing this bill. It feels like after 5 years of this being the #1 injury to our youth, young people in Minnesota, we owe it to them and we owe it to future generations. And for me, this lands very squarely in the public health sector. And thank you for your leadership. Thank you, Madam Chair.
Representative Chair Bierman, closing comments.
I just want to thank the committee and the testifiers and all the people who came up for this hearing. It's nice to have a bill where we don't take an up or down vote right now, and I think it enables us to further work on this bill. It will be coming back, and I want to have the input of all of you on it going forward. I will just say that all bills reflect values, and this bill reflects the value of the importance of our youngest citizens who are in they're in a bad place when their top cause of their death in this country is gun violence. So we need to do better, we can do better, and this committee can help do that right here in the state of Minnesota. Thank you.
Chair Bierman renews the motion that House File 3668 be laid over for possible inclusion in an omnibus bill. The bill is laid over.